need to know before a tummy tuck. This is Dr. Shim Ching, board certified plastic surgeon in Honolulu, Hawaii. I'm going to talk to you about part 2 of what you need to know before a tummy tuck. So in our first video, we talked about the scar location, the belly button, and also the muscle repair. The other things that I'd like to talk about are liposuction. Now, not all plastic surgeons will do liposuction with a tummy tuck. I feel it's very important. And it's important to ask why a surgeon would or would not want to do some liposuction with your tummy tuck. There are areas that collect fat that are around the area that we do the tummy tuck procedure, where we take out the skin, tighten the muscle, rebuild the belly button. It's almost like the frame of a picture. So those include the upper abdomen, the flank area, as well as the mons pubis, the pubic area. There's almost always some sort of fat deposit in those areas when I'm doing a tummy tuck. And if I leave them, they're gonna leave unsightly bulges all around the work that I've done. So we can make the abdomen really flat, but then you have this extra fat around it and it just never looks right. I almost always, unless the patient's very thin, they don't need it, I always do liposuction in these areas to shape those areas so that everything looks great around the area that we're actually doing the tummy tuck. I think this is very important. Not all surgeons will do this. They may say that it's dangerous or they don't like to do it for whatever reason, but I do it all the time and it works very well and it gives patients, in my opinion, what I feel is the best result. So liposuction is important. Please ask about liposuction before going into your procedure. The other things that people will ask me before a procedure is how long is my recovery going to be? A lot of women have had kids before a tummy tuck. As I mentioned before, this is something that almost the majority of patients at least have had children leading up to them wanting to have a tummy tuck. And we say to patients that the pain level from this procedure is similar to a C-section. Not quite the same, C-section's a bit different, but the pain level and the degree of restriction afterwards is around the same. Around 2 or 3 weeks of recovery where a patient just wants to rest at home, not do too much, be out too much, not travel around or drive around or do anything too active, no exercise during those 2 or 3 weeks. And then to gradually resume activities, gradually resume exercise, and we have a whole sort of protocol that we guide patients through and what they can and can't do afterwards, which is also very important to review with your surgeon. Generally, we don't want anything that's really strenuous that's going to cause any stretching or tension on the incision from the tummy tuck, as well as any engagement of the core, because we repaired those muscles and we don't want anything to be disrupted if a patient tenses those core muscles. Pain is really well controlled with pain medication, sometimes narcotics, sometimes things that are a bit not quite as strong. We give patients a lot of different options regarding the pain medication, how to manage the pain, but everybody gets through it. In surgery, I like to inject local anesthetic and we mix it with a little bit of steroid. This causes the local anesthetic that we use, which is long-acting ones, to last about 12 up to 20 hours or so. And that works really well. We inject all throughout the abdomen, block certain nerves, so that when patients wake up from this procedure, there's really very little pain. It usually builds throughout the night, and then the first day, 2 or 3 days are probably the most painful. But that initial local anesthetic that I inject really helps the patient, and we found that patients do really right after surgery because of it. The last thing I want to touch on is what is a mini tummy tuck and why can't everybody have one? Mini tummy tucks in my practice are similar surgery to a full tummy tuck. However, the incision is really short. Usually it's only about this long, a bit longer than a C-section scar. And how can we do this and for patients to have a good result? These are patients who only have maybe some fat removal, but primarily it's the muscle layer that's gotten stretched out, and that makes their abdomen really rounded and full looking and makes them look like they're still pregnant. So it's really primarily just what we call muscle laxity or abdominal wall stretching and roundness of the abdomen that we're seeing. And there's very little skin to remove, and usually there's very little fat to be removed. These are usually slim patients who have had kids and just have that rounded appearance without a whole lot of need for skin removal or liposuction. As you can imagine, very few patients are good candidates for this. I would say about 10% or even less of my patients will qualify for a mini tummy tuck. And the main reasons for that is because a large amount of skin needs to be removed. So with a mini tummy tuck, that short incision is made. I take out a little piece of skin, maybe about this big. So it's really very little skin that's removed. And we go through that incision, we do the full abdominal wall tightening. Usually the belly button, because we're not taking out that area of skin around the belly button is just what we call floated down. So it's detached and reattached to the abdomen in a slightly lower position, and maybe a little bit of liposuction is done, but you can sense that it's a much smaller procedure. And patients who have or are able to grab a fair amount of skin in their abdomen, the skin is quite loose, just won't benefit from that procedure. It's not something that they're going to have a great result from. And that's why the majority of patients need a full tummy tuck and not a mini tummy tuck. If you like this video, please smash up the like button and subscribe to our channel. Next up is going to be liposuction, probably the other most common procedure that I do along with breast augmentation and tummy tucks. Liposuction is something that I do all the time, and I'll talk all about liposuction and what you need to know before your procedure.